Hi everyone, I am going to give you a tour of Radiology Lab. We are going to go into the first room, that is room A, and what you'll notice is we have chairs with a lead apron that's draped over the back. This is where we keep the apron when it's not being used. We don't use it, we don't have to wipe it down when we use it with Dexter, but when you use it on a patient, you'll wipe it down and then drape it back over the chair. So we have our chair and we have our lead apron. And a couple things about the chair, this is going to be a little tricky, is the height is adjusted here, just like kind of an like a hairstyling salon chair. You just pump it. And it doesn't come up too high, but you want to see if you can get up as high as you can so you don't have to bend over. And then the headrest is adjustable. You pull this lever out, and then you can bend this, and you can bend this part as well. So you'll adjust this to your patient so that their occlusal plane is parallel to the floor, and you'll also have to adjust it with Dexter. So we have the trash can there. We have the storage unit. Down here, we have Dexter. Dexter lives down in the cupboard. And then the computers will be on, and this is where you'll log into Axiom Train. When you are setting up a unit for Dexter, the only thing you have to cover in plastic is the sensor. This is the sensor, and this is what would take the images on, and you will cover this in a plastic sheath, and I'll show you when I do the Dexter demonstration. I'll show you that. And then you'll notice here's our X-ray unit pushed up against the wall, and this is how you always want to store it. You want to store it with the bend nice and close to the wall. And we're going to adjust the timing. Remember how the MA and the KVP are, those are not adjustable, but we adjust how many seconds the button, how many seconds the impulse is. So how many, so depending on what tooth you're taking an X-ray of, you will change the setting. So the two teeth up on top of each other is Bitewing. This is a mandibular molar. You see the roots are pointing down, so that's a mandibular molar. This is a maxillary molar. The roots are pointing up, and there's 3 of them, so that's a maxillary molar. This is I think this is a canine because it's kind of rounded. So you'd use this for maxillary and mandibular canine, and this is for maxillary and mandibular incisors. So you can change it here, but you don't have to. If we go out of the room, and you always want to make sure that your chair is facing the window. You see there's this little view window. So if we go out of the room, we come out here to the sink. So for this room, this is your panel here, and you can see you have the same. If I turn this on, well, I'll turn it on in a second. You're going to change the settings depending on what, and I'll show you this when I have Dexter set up. So here we have some supplies. You have your disposable Bitewing tabs. You have posterior PAs and anterior PAs. These are all disposable tabs. We have the sensor covers, some gauze, cotton rolls, and these little green things back here, these are like a squishy, kind of comfortable little cover that goes over the sensor so that it's not so pokey and hard in the patient's mouth. So those are for patient comfort. And then the last drawer, we have some toothpicks, Q-tips, and some other bite blocks and sensor holders back there. You can reach into this set of bins as long as your hands are washed and clean, so we don't reach into here with gloved hands. Here we have some level 3 masks that we'll use once we're in patient care, but until then you can use just a cloth mask or a level 1. We have our gloves, mouthwash, hand washing, and then we come over to the exact same setup and room B. So we have all rooms are set up the same. There's just, you know, some little individual quirks depending on the equipment. Dexter is still in the lower cabinet. And then if we walk down here, you'll see Pano, and we'll talk more about that when we actually get to that point, so I won't go into depth on the Pano. We have room C here, and Dexter's down in there. And then our last room is down, and again you can see there's the little bins with the supplies, and then the last room is right here. Okay.